Hello everybody, this is Alex from Swoosh English. Thank you very much for attending our class today. I'm really excited to have you all in here. Just give me 1 second. Okay. Fantastic. So great to see so many people in the class today. We've got Ahmed, Ambali, Annie, Babu, Baha, Binit, Sissel, Danish, Densi, so many people. So thank you very much for attending. Please let us know in the chat box if you are a doctor or you're a nurse, and let me know when your examination is as well. I would love to know, because the more information that you give us, the more we can help you in today's session. So it's vital that you tell us as much as possible. What are you finding difficult with the OET exam? Have you taken the OET exam before? What were your results? And how many times have you taken it? Or are you a completely new student and you'll be taking it for the very first time? So please let me know in the chat box. And you can, I can see we've got nurses, doctors. Khalid is a doctor. Panwa is a doctor. Nurse, Babu is a nurse. Dr. Jitin, exam is on the 2nd of December, first time attempt. Very good luck to you, Jitin. Who else have we got? We've got Love Me. Love Me is a nurse. My exam's in November, said Rafida, so next week. So hopefully this session will be helpful to you today, Rafida. And we've got Joanna is a nurse who's taking her exam next week as well. Good luck to you, Joanna. We've got Ma, who's got their exam next week. Good luck to you. Also, Baha's sitting it next week. Good, good, good. So we've got lots of people here that we can help. And I would love, love, love if this session was helpful to you today in order for you to help to pass and get 4 Bs in the examination next week. We've got Gina, who's got her exam next week, who's a nurse. Sanjita again got her his or her exam next week, but also took the exam in October. So you should be getting your examination results next week. So fingers crossed for you. And we've got Annie said hi all. Good to see you, Annie. And Densi, exam is in November. Fantastic. So today we're going to be doing an OET writing letter correction class. This is always the biggest request that we get from students, is with regards to how can we help them with their writing. So we want to go through today with one of our UK native OET teachers, Fiona. She's very experienced with OET. She's an ex-IELTS examiner as well. So you're in for a real treat today, and also I'll be teaching you too. But most of the session will be taught by Fiona, and she'll be going through a letter from start to finish, telling you what you need to do to improve your grammatical mistakes, really focusing on structure, looking at the case note information. Are you including the relevant case notes? All of these things, your language as well, your variation of language, and cohesion and coherence of your letter. So this is something that we'll be going through in detail today, and that's going to be starting in the next 5 minutes or so. So Fiona will be coming into the class, and we are excited because this will be the 6th month. I think it's the 5th or the 6th month we've done the OET challenge, and this is our 7-day course that we do just before students take their examination. So we do it 1 week before, 7 days before the examination, to give students that last minute support that they need in all areas: reading, writing, listening and speaking. So we'll be going through that later on. That's a paid course later on, but of course if you're just here for the free class, then that's fine as well, as long as we can support you in some way. But there's always students asking for a paid course, kind of like a crash course just before they take their exam. So we'll be giving you more details about that later on. But what I am going to do now is I'm going to bring in Trushar, who is our he's from ID Medical, which is one of our big recruitment agency partners. They have relationships with 90% of NHS hospitals in the UK, and they have got some fantastic job opportunities for doctors and nurses. If you have not got if you're not registered with an agency, you don't have a job offer right now, they are working with us to help you as much as possible. And I'll be telling you a little bit about a 50% scholarship that we've got very soon, which we're running in conjunction, in partnership with ID Medical. So if you want to get our courses at a 50% reduction, and you want to register with ID Medical, who can help you to, to work with one of the best hospitals in the UK that's right for you, then please do that. So Trisha will be telling you about ID Medical. I'll bring him in now, and I'll tell you very briefly about the OET 7-day challenge that we've got running, and it's going to be starting on Saturday. But 95% of the class today is going to be about really looking in detail at your OET writing, really correcting a letter from start to finish, and helping you with any questions you've got about OET writing as well. So 95% of today will be helping you. 5% will tell you a little bit about the OET paid challenge starting on Saturday. And here is Trusha. Now I'm going to bring him in, who is going to tell you a little bit about the 50% scholarship that we've got running with ID Medical. Trusha, hopefully you can come up on screen. Fantastic. Okay, let me just unmute you. Hi, Trusha, are you there?
Yes, Alex, can you hear me okay?
I can perfectly well, Trusha. How are you?
Yeah, great, thank you.
Fantastic.
Thank you for the opportunity for me to speak to the class today. As Alex has mentioned, everyone, I'm from ID Medical. We're the UK's largest healthcare recruiter. We're working with over 90% of NHS hospitals and have around 3,000 doctors and nurses that work for us every day in the NHS. So we are in a position where we can offer you both permanent work, including tier 2 visa sponsorship, or locum work if you're looking for more of a flexible arrangement. We're really proud to be partnering with Swoosh on their scholarship because we're really dedicated to actually supporting candidates with achieving the scores that are required by the NMC and the GMC in order to start work. We place over 500 international candidates every year into the NHS, and as a result we're actually officially recognised by the GMC as being the official sponsor of the GMC Welcome to UK Practice Sessions for Doctors, which is an introductory course for international medical graduates. So we're actually at the GMC offices around 6 times every month, meeting with doctors that have got their GMC and supporting them with their job search. With regard to doctors' jobs, we've got over 370 vacancies available right now across the NHS and working in various different trust types. We also have lots of opportunities for nurses. There's a massive shortfall in the UK, which I'm sure you're aware of. So if you haven't already got a job offer, we can offer you various different opportunities. We're including, trusts up and down the country, and with interview activity taking place on a weekly basis once you've got your OET or IELTS scored. So, if you are still considering which option's best for you for the UK, or don't have a job offer, we'd be really keen to consider you for our scholarship program. We've got limited places available, so if you do think you meet the bill, then certainly please, I encourage you to register for that so we can review your application and hopefully get you on board and take you towards one step closer to passing the exams.
Fantastic, Trisha. Thank you very much for that. And yeah, it's a great opportunity that we've got a 50% scholarship for the program. So the 50% would be covered by yourself, and 50% would be covered by ID Medical once you've registered with them and they've approved you, etc. And this, very briefly, just before we get into today's class, if you want to get access to that 50% scholarship, then we're going to put these links in the chat box for you later. But I've also put a link in swooshenglish.com/OET-challenge. However, I must warn you that places are very limited, as Trisha mentioned. We've had a huge response to this so far, and it can't be for everyone. However, if you do meet the criteria, then you'll get access to this scholarship. So it's a fantastic incentive that you've got here. Not only have you got to get a scholarship on this program to help you with writing corrections, or our speaking mock exam class courses, etc., but you've got access to ID Medical, who are going to give you help and support, guidance, and help you to match you with one of the many NHS hospitals that they're working with in the UK. So it's a really good opportunity for you. So thank you very much for that, Trisha.
No problem. Thank you. Cheers.
Cheers, Trisha. Okay, everyone. So fantastic. So if you've got more questions about that later, then let me know. But let's move on to today's class. I put the link to the OET challenge inside the chat box for you. But aside from that, we've got, who else have we got in today's class? We've got Dr. Hamdi, he's got his exam next week. We've got, Cecil says, I want to learn how to write the last paragraph. There's some question marks and a few choices about child psychiatrist, clinic, home management, district nurse. Yeah, we're going to cover all about OET writing in detail today. Like I said, we'll be correcting a letter and telling you what you need to, what kind of improvements you need to make to your letter to where it is right now to where you want it to be. So if you're at that C+ area of the OET writing and you're looking to get a B, then this is the class for you right now. Some students might not even know what their level is, and so if you've got your examination next week and you're looking to you're really looking to make those improvements to go from a C+ to a B, then this is the class for you today. So I'm going to be bringing Fiona into today's session. And let's see if she's here. Is everyone ready to start the class? Please let me know. Say, yes, I'm ready in the chat box so that I know everyone is going to be taking part. It has got a pen and paper handy to take notes, because I don't want you to just watch the class. I want you to really take part, really get involved, ask questions, tell us what you're learning in the chat box. Okay, we've got lots of people saying, yes, 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 I'm ready. Fantastic. Okay. Rafaida, Rasha, Amberly, Tasia, Rana, all saying yes, 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 I'm ready. Fantastic. Okay. Joanna, Neethu, Jitin. Fantastic. Okay. So I'm going to bring Fiona into the class now. As I said before, she's one of our experienced OET teachers. She's put together a lot of our OET writing video courses, our model answer video course. She does our live classes as well inside of our paid VIP program, and she's done some of our OET challenge classes before as well. So very highly experienced, and she's an ex-IELTS examiner, so she's got that examiner perspective as well as being, of course, a teacher. So I'm going to bring her in now. So let me know if everyone's ready. Ansie's ready, Jitin, Cheryl. Fantastic. Okay, I'm just going to bring Fiona in now. Let's see if she can hear me and see me. Hello, Fiona.
Hi. Hi.
Hi, how are you?
I'm good, thank you. Yes, how are you?
Very good. Very good, thank you very much. So Fiona, it's great to have you in the class today. We've got over 60 people in the class, and then we've also got people on Facebook Live as well. Lots and lots of people watching. So Fiona, if for anyone who's not been taught by you before, and actually I should say in the chat box, let me know if you've been taught by Fiona before. We've got some of our current students, current VIP students in the class, so please let me know and tell us what you think of the lessons that Fiona's done before. We always get a really good response. But anyone who's not been taught by Fiona, please let me know in the chat box and tell us what you think as well if you have been taught by her before. But yeah, Fiona, for anyone who doesn't know who you are and how you can help them, can you just tell us about your experience and with OET as a teacher as well, and how you can help the students today?
Okay, yeah, sure. So I have about 20 years experience teaching English, and a lot of that has been teaching exam preparation classes, and more recently OET, although I have a lot of experience of teaching that. I teach OET, as Alex just mentioned. I teach the Swoosh classes for OET every week. So we do speaking and writing, and also reading and listening. So yeah, I'm pretty familiar with what's in the exam, and I'm looking forward to helping you guys today to improve your scores.
Fantastic, Fiona. So I think everyone is ready. A lot of people are saying this is their first class with us, which is fantastic. So Hamza Hazim said he's had classes with Fiona before, which is great. Saida, never been taught by Fiona. Fantastic. Well, this is your opportunity. I think most students in the class today actually, I'd like to know before we start, who is doing self-study right now? And who's actually getting their letters corrected by a native English-speaking OET teacher? Let me know in the chat box. Oh, I don't know, Fiona, if there's a bit of is there a background noise on my side or your side? I think I might be hearing. Can the students let me know if you're hearing a background noise?
Nothing on my side, Alex.
Oh, okay. Let me know. Maybe it might just be my side. A lot of people saying they're only doing self-study. What I will say is before we start the class, so self-study, Jitin, who else? Opo, self-study, Mohammed, self-study. What I would say for writing, everybody, is so important, and speaking as well, is if you've got your exam next week and you've spent $500 US dollars on the exam, okay, it's a significant amount of money. It's a lot of money. What I would recommend for you before you go ahead and take that exam next week is find a good quality, ideally a native speaking good quality OET teacher to correct your letters before you take your exam. I'm seeing so many students right now getting BBBC or BBBC plus because they're just doing a self-study, and if you can guess, and you guessed correctly, the C and the C plus is in the writing, because if you don't have anyone correcting your letters, how do you know what mistakes you're making? How do you know what grade you're at? Do you know if you're at a B or an A or a C or a C plus or a D? You just don't know. So because you're not a teacher, you're a second language learner. You know, English is not your native language. And I just see so many people sending me emails after they've got their results, and they say, I regret that I just did self-study, I didn't find a teacher. So whether you choose Swoosh English or you choose another school or another teacher or another website, I would highly recommend you to do that, okay? Does everyone get that on board? So Saida says, I'm getting my writing checked or by a teacher, that's good, okay? I'm getting my letters corrected by an English tutor, said Densi, that's good as well, well done to you. But the students who are doing self-study like Love Me Lucosi, who else? We've got Pedro, Winlai, my husband is correcting for me. Jayoti, if your husband is an OET native English-speaking teacher, then that's great. But if your husband's not, then I'm not sure about that approach. But yeah, Jitin self-study, lots and lots of people saying self-study. But yeah, definitely get a teacher who's helped students pass before to correct your letters. That's what I would say to you, because you don't want to pay $500 for the exam again and again and again and again. Okay, does everyone get that? Say yes, I understand in the chat box. But aside from that, everyone, I'm going to pass you over to Fiona now, and she's going to teach you the class.
Okay, so yes, just very quickly, I completely agree with Alex on what he just said. I have so many students come to me, either OET or IELTS students, who have taken the test lots and lots of times, and you know, each time they get the same score and they never improve. So invest in a teacher. Absolutely, Alex is absolutely right there. So I'm going to share my screen with you right now. Okay, so perhaps you could tell me in the chat box whether you can see my screen and whether it's clear or not. So today we're going to look at two OET writing tasks. One for, you'll see here, this one is medicine for doctors, and the other one is going to be for nurses. So we're going to basically go through the case notes, and we're going to look at one student's response in each case to each of the writing tasks, and we'll break down the individual scores and explain what mistakes they've made, how they can improve, and why they got those scores, and what the overall score was. Okay, can everyone see my screen? Perhaps Alex.
Looks quite good, Fiona. I'm just thinking maybe you could zoom in a little bit more. Yeah, oh, perfect. Yeah? There you go, perfect.
Great, okay, and I'm just going to get my notes ready here. Okay, so we have the case notes. As you know, you have 5 minutes reading time. Can't write anything, 40 minutes to write after that 5 minutes reading time. So we have this man, Mr. Brett Collister. We've got all the information. I'm sure this is fairly familiar to most of you. Patient details. So yeah, we've got all of this information here. Occupation is not. So basically, when you're reading through the case notes, you need to be deciding, okay, is this relevant? Is this relevant? And actually, the first thing you should do, and I should do that too, is go to the writing task, okay? And we're writing to this person, this doctor, and he's an endocrinologist. Okay, so that is really important, and you are requesting assessment and a management plan. Okay, so that's why you have to go here first, because you need to know who you're writing to, because that dictates what kind of information you're going to include. So he's a factory foreman, married, 3 children. Maybe some of this isn't really relevant. Watching football, playing darts, fishing, his hobbies. Okay, These are quite sedentary hobbies. Maybe we would, include that depending on what's wrong with him. No known allergies, mononucleosis. This might be relevant here at some stage in the letter. Then we look at his treatment record, and it's important to look through the dates. How many visits has he had? So he's had quite a few visits. So this is April, June, September, November, and then I think he came back again February, also February. So quite a few visits, and you're not going to be able to include all that information. Okay, so that's important. So we can see all the treatment that he's had: sore throat, productive cough, sore shoulder, sore right knee. Lot of information, might not all be relevant. Possible osteoarthritis. Shoulder has improved. Advised to lose weight, increase exercise, cycling, swimming. And then he comes in, he's sort of progressively worse, overweight, unfit. And let's see what the diagnosis is. Preliminary diagnosis results indicate diabetes. Okay, type 2 diabetes. So obviously that's important. And the fact that it's diabetes will dictate what you write in the letter, which obviously a lot of it is going to be his weight, his diet, lifestyle, etc. Okay, and blood pressure, review of tests. You're going to want to talk about fasting, glucose, etc., etc. So that is the case notes. So hopefully we are now familiar with what's in the case notes. Now we're going to look at one student's response. Okay, so we have here everything in the right place. On the top left, the address, and then we have the date. I'm not going to go through that in too much detail. This part is not, you're not really going to get marked on this part. It's the body of the letter that you're going to get marked on, okay? The date is quite important, today's date. This is all fine. She's done this really well. Read the person's name, date of birth. Okay, and so we start the letter. I'm writing to refer Mr. Brett Collister, a patient of mine who is suffering from type 2 diabetes and overweight. He works as a foreman in a factory and is a married man who has 3 children. Okay, so yeah, we're just going to look at this part. Fairly good introduction. I'm writing to refer, and then a patient of mine who is suffering from type 2 diabetes. This is a nice grammatical relative clause. You can't say and overweight. You'd have to say and he is overweight because you have to have similar structures on either side of the and. That's called parallel structure. You need to come to classes to understand these things totally, but maybe you already know them, I don't know. But anyway, generally the grammar and the information are quite good here. Not sure if we really need this. Okay, he works as a foreman in a factory, not really that relevant. 3 children, again, not really that relevant, having read the case notes. Here, Mr. Collister has no known allergies and has a past history of infectious mononucleosis. He is a dart player. Okay, so this would be darts player. I don't know if you know what darts is. It's kind of a game that you play in the pub in England. It's with little arrows that you throw at a board. I don't know if that's really relevant. Do you remember I said that maybe mentioning sedentary activities, it would be relevant. And the fact that he's been preliminarily diagnosed with type 2 diabetes would totally indicate that you need to talk about the fact that those activities are sedentary. You don't need to say what they all are, fishing and darts. And so that's not really that relevant. Okay, so let's go on to this paragraph. He has visited and been treated in my clinic several times for, here you would say recurrent for recurrent throat infection, left-sided shoulder, sports injury. Okay. and right-sided knee pain. Okay, this is directly taken from the case notes and not really appropriate, written in this way with a question mark in front of it. Okay, so you could here write, which I suspect may be due to osteoarthritis or something like that. You could actually get a nice relative clause in there. He was also advised to modify his lifestyle and to reduce his weight. So nice passive here. Also, yes, he was advised, and also is in the mid position. So this is always impressive. He was also advised, instead of saying also, he was advised. So that's really nice. Modify his lifestyle, reduce his weight. Some nice language here. Okay. So the language is pretty good so far, and she started with, you know, the visits, and she's kind of summarized the visits in this paragraph, so that's also good. This time, I wouldn't say this time, I think 4/02/18, is that today's date? Let's just double check that. Okay, so no, that was on the most, this is today, and that was on the most recent visit. So you probably say, or just say this, literally on this date, patient came to my clinic. With complains of, I would here say complaining of. So complains is not a noun, it's yeah, to complain is the verb, and complaint would be the noun. Lethargy, painful eyes, and on and off dizziness. This is a little bit informal to say on and off. For the period of 3 to 4 weeks. For, I'd say, the previous the previous 3 to 4 weeks. And you can write numbers here, but I think you wouldn't really be able to have a dash because it's part of a sentence. So 3 to 4 weeks. He also mentioned that he's very busy with his work and still has not made any changes in his lifestyle. Nice grammar, nice language. The patient, okay, there's a problem here. You might notice the patient has given some blood tests. The patient didn't give the blood test. The doctor would have given the blood test. So I would maybe change this. Blood, to make it a little bit more formal and more concise, you know, fewer words. So blood tests were taken on the same visit and reviewed 3 weeks later would be better. And then here, which shows, now which should refer back to the thing that's sort of immediately before it, but you're not referring to 3 weeks later, right? So I think you'd need to start a new sentence and say these show and then, yeah, the results all here, okay. And then here again, there's a little problem with the passive. He is being newly diagnosed with type 2 diabetes. Also, so first of all, the content of this, it's not he has been diagnosed, it's a provisional diagnosis. So I might say, I have therefore, or let's make it passive, let's make it impersonal. You can use I, but he has therefore been provisionally diagnosed with type 2 diabetes. His BP is and pulse 78 regular, that's fine. I would appreciate your assessment and plan of management regarding his diabetes. Capital P, so just a small punctuation mistake. Please do not hesitate to contact me with any queries, and queries is spelt incorrectly. We shouldn't have an A here. Okay. So you may notice there's quite a lot of red here, but you know, the red is, it's the candidate or the student hasn't made, the mistakes that she's made have not affected the meaning. Okay, so that's important. If you get writing back from someone, from a teacher, and there's lots of red all over it, it might not, it still might mean that you've passed. Okay, so don't be disheartened. It's just sort of being, improvements are being made. Okay. Okay, so let's have a look. This kind of thing you can learn. I would appreciate your assessment and plan of management regarding, and also this, okay? Most things I would say you can't learn, but this is something you write in all letters, okay? Okay, so how did she do? Oh, these were my original corrections, so let's just go through them, go past that. We have the scores here, and we've got, for example, overall task fulfillment. We have 5 criteria: appropriateness of language, and various others, but I'll just show you what these mean in terms of what Riva would get for her OET. And you might wonder what 3+ means. Well, we at Swoosh go from 1 to 5, and 4 and 5 being a pass, you know, the equivalent of a pass. So overall task fulfillment, 3+ is almost a pass for this particular one. Okay, so she's included the main points, but she does have a little bit too much detail. She said that he's busy with work. She gave all the details about the test results. It's probably enough to say that the results pointed to type 2 diabetes, so maybe not all of those details. A little bit too much there. And she should also emphasize that this is a provisional diagnosis, because that was in the notes, okay? Appropriateness of language, very nice, yeah. 4 she would get for that. She used mostly formal expressions. There were some inconsistencies, she said, on and off, which isn't, you know, is a little bit informal. Comprehension of stimulus, this is how well you gather all the information from the case notes and how you put it together in the letter. Relevant information selected, but there's too much detail. Most of the information is in prominent parts of the letter, so you need to communicate the important information in you know, for example, the diagnosis, provisional diagnosis in the first part of the letter. And yes, but I've said here, reason for diabetes should be mentioned earlier and allergies later. So I think in this part, okay, could be included later in the letter, because it's not so relevant. And maybe here in this paragraph, they should already be mentioning the, you know, the fact that the provisional diagnosis is type 2 diabetes. And perhaps also a little bit more about weight, although we do have something here. So we've got, he was also advised to modify his lifestyle to reduce his weight. Possibly we could say in this paragraph, maybe we don't need to mention he's very busy with his work, and maybe still has not made any changes to his lifestyle, could be here next, you know, with the information about the weight. Okay, so we could possibly improve the order of the information there, and that comes into comprehension of stimulus, which is why she got a 3 for that. Okay. Grammar, there are a few grammatical mistakes, a couple of tense problems, but they don't affect the meaning. And there's some really good use of linking devices, which I mentioned before. And the letter really flows really nicely. Okay, so, what I mean by flowing is that how well it all sticks together, how well the sentences go together. So here she's got information about, all the visits in this paragraph, and then she's got some good linking devices. Okay, so yeah, it's nice and easy to read, which is important. Control of presentation features, spelling, punctuation, and layout. Good layout, yes. There's layout means how well the paragraphs, how easy it is to read in terms of the paragraphing. So it all looks good on the page. It's what you would expect when you look at a letter. You would just be able to look at this without reading it and think, oh, yeah, that's a letter, yeah. And you've got yours sincerely, etc. I don't think you would be able to sign with your first name, just Doctor, and then your last name would be the best way. One mistake with spelling, not a problem. It doesn't impede communication. So overall, probably would be a 3+, which would almost pass. This is very borderline, but it's almost there. I think the main issue is the fact that the information is a little bit, some of it's in the wrong places, and there is some irrelevant information, but it's pretty good. Okay. So, I'll stop talking right now. Maybe someone has a question about that. We're going to go on to the nurses in a minute.
Definitely. Thank you very much, Fiona. So as you might have seen, so we've just done a doctor's letter, and then we're going to move on to a nurse's letter, just to help both parties, because I know most people, well, probably everyone in here is either a doctor or a nurse. What we want to do before we move on to the next letter, please tell us the number one thing that you learned from Fiona's correction about your own writing that you didn't know before this part of the lesson that she just taught you. So please let us know in the chat box. I think we've got a couple of questions coming through in the chat box as well. But yes, please tell us the number one thing that you learned from the corrections that she just provided you, that Fiona just provided, and let us know what they were, because we want you to take what you're learning today and put it into practice with your own writing. Really, really important that you can apply these things. Okay, and we'll be talking a lot more and going into more detail about your writing in the OET 7-day challenge, which starts on Saturday. I'll be telling a little bit about this. Be telling you more about this program at the end of the class today. But let's see what questions we've got coming through as well. Okay, yes. And I'll tell you on Facebook as well, Fiona, what questions have come through.
Okay, so I found one here from Win Lai Lai. She says, as I have, so to get a grade B, we shouldn't use digits like 3 or 4 in writing, so just the numbers. You can use abbreviations that the person reading the letter would understand. So I really, that really wouldn't be a problem. Okay, you're writing a letter, maybe you'd like to, the smaller numbers you might want to write in full, but it would not be the difference between a B and C, that small thing. So, be careful of, hearing rumors about, oh, I've heard that to get a grade B, you have to write the numbers correctly. It's not science. It's not a mathematical formula. So just beware of that. Yeah.
That's a really good point, Fiona. We always get people every single week saying, I've heard this, or there's been gossip about this, rumors about that, that someone said that this is right and this is wrong. They as I say, you probably heard me say this many times, Fiona. They're not there. The examiners are not there to penalize you, to take marks away from you. They're there to give marks where you are deserving of them. So just don't focus too much on these little little kind of things, because like Fiona said, it's not going to make a huge difference to your score. With license, thank you very much.
Exactly. Yes. Good. So Cecil says, is been suffering from or has been suffering from? Has been suffering from is correct. That is the present perfect continuous. If you're not sure about that, you might need to come to our classes or find a teacher. Yes. So yeah, has been suffering from means from the past until now. We don't have too much time to go into lots of detail about grammar. So Khaled says he's learned not to mention all the details. Yeah, fantastic. I'm glad you've learned that, Khaled. Very important. So use that reading time really, really well to think about what you will include and what you don't need to include. Often the job, the profession. So this particular student, she always writes the profession. And I said, it's not really always relevant, to be honest. Could you please give an example of correct format? Not sure what you mean by that. I think you want... Do you think that's a question that's asking for the whole layout that's appropriate for every letter, Alex?
Correct. Yeah, that's exactly what they're asking.
There isn't one. There isn't a formula. It's not science. Sorry. You need to be able to communicate effectively per time, for each different task. Okay. So there are some things you can learn. The kinds of information you should include, for example, in the first paragraph, the kinds of information, I am writing to refer, and then what the problem is, and then in the last paragraph, expected action. Yes, there are some things, but there's no formula, unfortunately. Now, Saida says, is it okay to write the short forms of the tests, RBS, FBS? Okay, the question is, do you think the person reading your letter would understand those abbreviations? And if you think yes, then you can write those. So you're writing to a colleague a lot of the time who is a medical professional. Okay, so if you think they would understand them, then go ahead. If they're kind of universal, sure. Okay.
Last question, Fiona, I'm just worried about time before we move on to the next question. The other thing is, sorry, Fiona, the other thing is we always get students putting their sentences in the comments box and wanting us to correct them. We unfortunately don't have enough time for that. So we want to try and answer people's questions. But if you want your writing corrected, I would love to see you in our OET challenge that we're going to be starting on Saturday. I'll tell you more details about that later and tell you how you can get involved and get teachers like Fiona and our UK OET teachers to mark your writing and tell you what you're doing right, what you're doing wrong, and giving you a grade. Because you can see, for example, from Fiona's correction of that doctor's letter, that was one of the doctors in our VIP program. You can see how great it is to have your writing corrected and to be given a score and telling you, in each area where you need to improve. So this could be the thing that you need a week before your examination. But yeah, last question, Fiona, and then we'll move on to the nurse's letter.
Okay, someone said, is it okay not to use the passive? How many said, I noticed no passive language? There was passive language, actually. Quite a bit of it. We're not going to go back, but yes, and so there was passive, and it's good to use the passive because it shows a higher level of formality. Okay, so it's not including the person who did something, but what was done to them. Okay. So yes, there are a million questions. I agree, but unfortunately, we can't answer them. I want to get on to the nurses and help them. With another.
But don't worry if you're a doctor and you've asked a question. We'll come back to questions later, and a lot of the questions will be, and the answers that we provide will be relevant for both doctors and nurses. Okay, so they're marking you in the exact same way whether you're a nurse or a doctor. It's just, of course, that the task and the case notes are different. So every answer that we give will be relevant to both doctors, nurses, and any other medical professionals for that matter who are in the class today, if you're a physiotherapist, dentist, etc.
Okay, great. So let's move on. Thanks, everybody, for your questions. Let's move on to, wait a minute. Yes, okay, this one. So, Mr. Gerald Baker, this is nursing. Okay, so we switch to that. But as Alex said, this is, both of these letters, the way you write them are relevant to all professions, so don't worry too much. Mr. Gerald Baker, you are the charge nurse. Who are you writing to, first of all? Very important. You're writing to Ms. Samantha Bruin, senior nurse at Grey Walls Nursing Home. Okay, this part is very relevant for this letter, and you'll see why. So this patient, 79-year-old patient, lives at Grey Walls Nursing Home. So you must realise that. That will dictate the kind of information that you're going to include and not include, because, you know, a lot of this will be known to them. He's been there for 4 years, so some of the background information, for example, you would not need to include. Okay, so he has had a total hip replacement on the left side. He has ongoing high blood pressure, so relevant. No children. Again, all of this probably not that relevant because the nursing home knows about it. So no signs of dementia observed. Medical background, again, possibly not that relevant because the nursing home knows about it. Medications, all of this is probably quite relevant, quite important, and should be in a prominent place in the letter because they'll need to know what medication he has been and is on. Nursing management and progress, so this is what has happened since the operation. Daily dressings, range of motion, stretching, strengthening exercises, occupational therapy, staples to be removed in 2 weeks, and follow-up FBE and UEC tests at City Hospital Clinic. All of this is relevant. Okay. Assessment, good mobility post-operation. This is also important. He's moving well. What he's moving with. This is also important. Post-operative disorientation, read time and place during recovery. So possibly relating to anaesthetic. Continued observation recommended. And if you remember here, it says no signs of dementia observed originally. So, you know, possibly something to look out for there post-operation. And his hemoglobin levels dropped and he was given a transfusion, also important. Discharge plan, all of this is always important. Monitor medications, probably not this so much. Continue exercise program, and the equipment that is required is also important. Okay, so let's have a look. We have a student who wrote this letter. Okay, address, date, all pretty good. Tiny mistake here. Ms. should be with a small s. And then Mr. G. Baker, age 79. I am writing to you. You wouldn't have to have to you, I guess, here. I'm writing regarding Mr. Baker, who was admitted to a hospital for a left total hip replacement and will be transferred back to your care today. Something wrong with his typewriter here. I'm not sure what's going on there, but it doesn't matter. Okay, nice. Okay, first paragraph, I guess you'll agree, has good and relevant information. Back to your care. Okay, that's important. So that will show the examiner, okay, this person knows, has read the case notes very thoroughly and knows that this person is going back to the nursing home. Post-operatively, the patient required blood transfusion. I would put an article in here, a blood transfusion due to low HB. Which is currently back to normal. I put a comma in here before the relative clause. Please monitor Mr. Baker, so make sure you get the name right, for signs of anemia. Disorientation was also noted, possibly related to the anaesthesia, but ongoing monitoring is the noun, is required. Now, okay, if you look at this sentence here, it seems a little bit out of place, and also you would need to start a new sentence. So, patient required a blood transfusion due to low HB, which is currently back. Perhaps you would need, it's currently back to normal, so you would need a linking device. However, he will need to be monitored. And then it kind of, this is all to do with cohesion, linking sentences together. So this links together much better, I'm sure you'll agree, because it's back to normal, but please monitor him. Yes, so, however, he will need to be monitored for signs of anemia. And then also you have a nice passive in here, so that's always a good thing in formal writing. Disorientation was also noted, possibly related to the anesthesia, but ongoing monitoring is required. Now, you probably noticed that before I added this was a kind of strange paragraph that wasn't quite the next paragraph. It was sort of a semi-paragraph. So I'll just show you what he originally did. Do you see what I mean? It wasn't a continuation of the paragraph. And yes, I told him that's this student is Italian, and I don't know if anyone's from Italy here, but I think that's acceptable in Italy to have a kind of a semi-paragraph if the topic is slightly less related. But, generally that's not accepted, and certainly not in OET. So disorientation was also noted, possibly related to the anesthesia, but ongoing monitoring is required. Some nice language, yeah, was also noted, possibly related to, don't know what's going on there, hang on 1 second. Yeah, oops. Yeah, possibly related to ongoing monitoring is required. There's another passive. The patient has shown would be the correct past participle, has shown good mobility. Being able to weight bear, no ing, and to walk short distances with the help of now this is wrong, a wheelie walker. So we've got a bit of a spelling mistake going on here. 2 weeks hire of wheelie walker, wedge pillow and toilet razor has already been organised. Yeah, this is a bit strange. First of all, because this is an adjective, we would say 2 week hire. So we're making nouns into an adjective, 2 week hire. So adjectives do not have S on the end, okay? And we put a dash, a hyphen in the middle to show that it is has 2 words being made into one adjective, okay? Wheelie walker, again, spelling, yeah, I'll just underline that. Wedge pillow and toilet have already been organised. So a bit of a basic mistake here. Regarding post-discharge management, so a nice introduction to the paragraph, yeah. This is also a nice introduction to the paragraph, so he would gain marks for that. Mr. Barker, so Mr. Baker, so try not to make mistakes like this because, you've got the name in front of you. Will require daily wound dressing, will require a daily wound dressing in addition to continuing, so in addition to is with ing, of the verb, with his exercise program and painkiller medication monitoring. And I think it'd be better to say he will also need. Yeah, and this person hasn't really mentioned what painkillers the patient is on, which I think is quite relevant. And he would have needed to do that probably in this paragraph here. I think part of this needs to be slightly reorganized. So in the second paragraph, you'd probably have, what medication he's on and has been on since the operation, how he's able to walk, etc. And then the complications would probably be in the next paragraph. Okay, so the blood transfusion and the disorientation, yes. Okay, this is nice though, the contents of this paragraph, because they are basically saying, this is what I want you to do. This is expected action, usually goes in the last paragraph. Wound staples removal and blood check test check will be performed on the 21st. I would say on September 21st, or, this is a lot of words. You can say, you can do it like this. I assume this was September, I'm 17. I don't know which date, which year. So doesn't really matter, but okay, so this is a good way of, this is very informal. We say this, the 21st of September, we say this in spoken English, but we don't write it. This is the best way to write a date, and it's acceptable in an OET letter, and it's one word, right? It counts as one word. So if you're worried about word count, do this. At City Hospital Clinic. Okay. Wound staple removal. Okay, again, this is an adjective that's been made into, this is a noun that's been made into an adjective before this noun, so no S here. Right, if you require any further clarification, please do not hesitate to contact me. Nice, okay. So, not too much red in this letter. Okay, which is good. Oh, don't need that. Okay, overall task fulfillment, pretty good. The information is generally communicated clearly and the reader would be informed. And there's also this, in this overall task fulfillment, it's all about the grammar as well, and does that stop you from understanding it, or does it make, if you have mistakes in grammar, does that stop you, does it make you have to go back and try to reread and try to understand what this person's talking about? So in this case, no, it's really quite clearly communicated. Appropriateness of language, good language, appropriate register. A register means the level of formality. So it was nice and formal. There's some really nice examples of language, as we saw. Good mobility. Will require daily wound dressing. Blood test check will be performed. Yeah, so it was pretty nice. So comprehension of stimulus. Relevant information has generally been selected. Some has been left out. Okay, so medications and the type of exercise. Type of exercise is not so important, but medications, I think that would be important, and that's why they got a 3 for this and not a 4. A better order might be as follows: treatment and recovery in the first, but actually the second paragraph, you talk about treatment and recovery. And then, as I mentioned, possible complications, possible dementia, and what happened with his hemoglobin levels. Expected action in the final paragraph. And monitoring for anemia maybe should be mentioned later than he has mentioned it. Perhaps also mention what his exercise program involves, because they'll need to know that. Grammar, pretty good. Couple of issues, but these do not affect the meaning. So yeah, there weren't any major grammatical issues. Cohesion was also good. Spelling, Wheelie Walker, and some minor layout issues with paragraphing, as we saw. So overall, this would actually get a 4, which is
fantastic. Fiona, I just want to say that, so for any students who are just joining, a 4 or a 5 would be like would be a pass, like a B or an A. Okay, so this particular nurse would have, this is one of our VIP program nurses, so they're on our paid programs. So they've not just written this one letter and then got a pass. They've actually worked up to get in this pass. So they were, this nurse was probably getting a kind of a C or a C plus before, and now they've improved their letters based on the corrections that all of our OET UK teachers were giving them, and telling them, like Fiona mentioned about the control of linguistic features like the grammar and cohesion, the spelling, the language, appropriateness of language, and the task fulfillment, all of these things. So this nurse slowly started to get better and better, and got from the 3s, kind of the 2s and the 3s, up to a 4. So that's how they've made their big improvements. What I was thinking, Fiona, is because I know some students will be interested in the challenge, and I know that a lot of students have got questions. So what we'll do is I'm going to tell students about the OET challenge for a few minutes or so, and then we'll go on to questions with from the students. So if you can kind of pick out some questions from students. So keep your questions coming, everyone, and we're going to answer them in a minute. Please let me know in the chat box, was this class helpful to you so far? Okay, we're not finished yet. We're going to answer some more of your questions, but please let us know in the chat box on Zoom or on Facebook if the class has been helpful to you so far. So Farzad said yes. Thank you. Sissel said very helpful. Mohammed said yes. Very helpful. Neethu and Mahi, Basara, Mazia, very helpful. Great. Okay, please let us know on Facebook as well if it's been helpful to you so far. Thanks a lot, said Ahmed. Really useful, etc., etc. And so the messages go on. Very professional. Okay, that's very good, said Ansi. Okay, Fiona, you're very, very professional. Is Ansi's comment.
Absolutely, Alex. Yes.
So she loves that. She loves that. So anyway, please let us know in the chat box, would you like your letters corrected for 7 days, okay, up until your examination? Say yes if you want your letters corrected. Let us know in the chat box, okay, on Zoom, on Facebook. Do you want the level of detail that Fiona's been going into today with grammar, with language, with case note information, giving you that score as well? Yes, all of our letters corrected, said Farzad. Yes, lots of people saying yes. Mohammed, George, love me, etc., etc. Fantastic. So I'm going to briefly tell you about our OET challenge, particularly for students who are doing the exam next week or next month, okay, because this will be really helpful to you. So I'm just going to share my screen, if you can see my screen here. And I am going to, I don't know if 1 second. Okay, so like I said, we are going to just answer your questions in a second, but what I really want to know is what's the main thing that you learned from the class today so far? Okay, what's the big thing that you didn't know before the class? I would love to know in the chat box what that was, because it's all about putting everything into action. I'm going to tell you about the OET challenge. It's not for everybody, okay? It is a paid course. I'm going to tell you about a 50% scholarship that True Sharp and ID Medical mentioned at the beginning. We're going to help you with reading and listening 2.0, as well as writing and speaking. Okay, we're going to give you letter corrections with lots of detail, okay? And you can see here one of our teachers, Stephen, was going into your letters and making the corrections, all of the things you were doing wrong, and telling you what you needed to do right, and then gave comments at the bottom. We've got self-study video courses for you with, you can see our teacher here, Catherine, going through an OET writing video, OET writing letter, and telling you what you can do to improve that. Then we're going to have speaking mock exam live classes as well, so role plays where you get to practice your role plays, and we're going to give you feedback and correction and tell you what you need to do to make those improvements to get a B or even an A. We've had students getting A's and B's before in all areas. So we can't accept everyone into this program. You know, you're going to get a lot of letter corrections for your OET writing, reading and listening video courses, as speaking as well, and writing, and you're going to have speaking mock exam group classes. It's only for students who've got a grade C or C+ in previous OET exams, or students who've taken IELTS and got a 6 or a 6.5. If you're getting less than that, it's probably better for you to focus on your general English right now. So we can only take on a small number of students. So please give us evidence of your previous exam results and your exam that you've got next week or in December to alex@swooshenglish.com. I'll put my email address in the chat box for you very, very soon. So this is an investment. You're going to have to put some money into the program, because of course we've got to give you all of our support of our teachers, and you know, of course we want to make sure we reward our teachers with you know, making sure that we give you all of the time and energy that you need. So, but we do have a 50% scholarship. I'll tell you a bit about that in a minute. So we try to keep the programs as affordable as possible, because we know the cost of the OET exam is $500. We want to make it as cheap as possible for you, but it's highly effective. This is the 6th month we've done the OET challenge now. So you can see here, we've got the program, the starter program for $99. If you want to go ahead with this, you will get 1 speaking mock exam class, 10 letter corrections on your writing, all of the support from our teachers. You can ask questions in the Facebook group and get support. Our writing video course. This is available for $99 for 7 days. It's starting on Saturday. Like I said, we've had some great results previously. We've got 65% plus pass rate for first-time takers. So we don't want you taking this exam 2, 3, 4 times. If you want to register with ID Medical and you want a 50% scholarship, then this program is only going to be $49. So $49 is paid by you and $49 is paid by ID Medical. So this is a really affordable program, and it's a fifth of the cost, or 20% of the cost of what it would be to take the OET exam again. So I would love to see you pass first time and join us with this. And then we've also got a more comprehensive package for you, which is $199, and you get 20 letter corrections, 3 speaking mock exam group classes. We'll give you our our model answers for writing, similar to the ones that Fiona has showed you today, and all of our reading, listening, speaking, and writing video courses, and we'll give you access to our previous live lesson OET recordings. So these are classes that Fiona's been doing probably since February now. So there's around about 6 or 7 months worth of previous live lessons that we have done for all 4 areas of reading, writing, listening, speaking. So it's $199 for 7 days. But if you want to register with ID Medical, you get it for only $99. So $99 is paid by you, $99 is paid for by ID Medical. So we've got a lot of people on Zoom, we've got a lot of people on Facebook Live watching. We cannot do it for all of you, we can only do it for a small number of students. If you're interested in this, I'll be doing a question and answer session after this session has finished. You can ask me any questions about the program and anything that you're not sure about if you're looking to sign up for this. But what I would say to you is, even if you don't join our Swoosh English program, that's no problem, that's fine, as long as you can get a lot of help from this free class. But what I would say to you is, and I said it before, I don't want to see emails from students after they get their exam results saying, I wish I'd have got a native English speaking teacher, you know, from Swoosh or another website or another school or another great teacher out there who's helped students to pass before. Self-study in the minority of cases can help you to pass. The majority of students need that little bit of extra support, particularly for the writing, and that's what really we want to be giving you in this OET challenge. So those are the 2 packages, here and here, $99 or $49 with the scholarship, $199 or $99 with the scholarship for starter or premium. So these are the packages. I'm going to hand you back over to Fiona now, who's going to answer some of your questions about the 2 letters for nurses and doctors today. So like I said, if you're just here for the free class, that's fine with us. But if you want that extra support and you want to pass first time, I would love to see you in our program. So that's everything. I'm going to hand you back over to Fiona now. I've just muted you, Fiona, so you have to unmute yourself.
Okay, so I've just been looking through some of your questions, and if we look back to Dempsey, Dempsey said, oh no, hang on, just before that, Russia, what about writing 90% active and 10% passive? Is that mandatory? I think you're talking about 90% active sentences and 10% passive sentences. I'm not sure. As mentioned, it's not a mathematical formula. You can't say 90% and 10%, or it's just how it works in that particular letter. Dempsey said, yes, I noticed that the use of linking devices does not mean that you need to put transition, just the ideas should flow. That's a very good point. So basically, Dempsey is saying, what I often say to students is that don't write a linking device at the beginning of every sentence. It sounds unnatural, it sounds mechanical, and it doesn't work. If you look at a native speaker, when they write a letter, or when you read a news article or something, you'll notice there aren't huge numbers of linking devices. It just has to flow. The ideas should flow, and the ideas should be kind of connected to each other. So good point there, Dempsey. It's not about just linking devices. It's how well do the ideas flow together? Okay, and Jyoti says, if patient is on multiple medication, can we say, please see the attached list of medicines and dosages? I don't think so. I think you need to mention the important medications in the main body of the letter. You do need to do that. It needs to be right there. It needs to be clear and in a prominent place. Maybe in the case notes they say, I'm also forwarding the patient's test results or something. Then you could say that. Then you could say, please see the attached report of their test results. Okay. And Billy says, we can't write with the complaints of. No, you can't write with the complaints of. You have to write complaining of. So the patient is presenting today complaining of whatever issue they have. Okay. Somebody said it's in between the name and date of birth, this is Farzad, should we put a comma between the name and date of birth? I would just put the name. You can put a comma and then the date of birth. You could also put the semicolon. You could also leave a space. That's a tiny thing, and they're not going to penalise you for that, I don't think. So Saida says, can I write the date before the address at the beginning? Yes, you can. You can write the date before the address or after the address. Totally fine. Annie Hodson says, should we include literally all relevant information to pass? Well, yes and no. You have to include relevant information. If there's a tiny thing that you've missed, you might still pass. So yes, it depends how important that information is. How to write the date. As I mentioned, I had just numbers with slashes between it, between the numbers. So I think that's the best way to write the date. You could also write, what's the date today? Today is the 25th of October. So the 25th of October is what we say, the 25th of October. But we write various ways, but October 25th with a TH. You could also write 25/10/18 or 25th October is also fine. So there are various ways of doing it. Let's have a look. Okay. Thushara says, what is the difference between is deteriorated and has deteriorated? Well, has deteriorated is correct and is deteriorated is not correct. So has deteriorated means it has become worse, and it's the present perfect, and we use the present perfect when there is an effect on the present situation. So the patient's condition has deteriorated. It means that it is still bad today, or it's still worse than it was today. Started in the past, continues to now, present perfect. Okay, we've got a couple of people talking about what is used in which paragraphs. Again, it's not a formula. So I don't know if you're referring to the nurse's letter, but in that one, the patient's had an operation, and then they were talking about post-operatively what happened, and then in the next paragraph, complications. So that was the best way to do that one. But it totally depends. Totally depends. If the patient is suffering from a disease a couple of years back and it's now treated, is it necessary to repeat it in past medical history? Again, it depends. So you saw in that letter, we didn't include, I think it was osteoarthritis, because the nursing home knew about it, right? So again, it depends. There isn't a formula. I'm sorry to keep saying that, but it's true. Okay. Yes, and Huawa says, also, you don't have to state all the results, just write the results pointed to type 2 diabetes, not pointed out to, pointed to. Yeah, exactly. So you don't, I think that person in that letter did probably include a few too many of the actual results, and I did mention that it's probably better to just say that they pointed to diabetes. So, yeah, a lot of these questions are about organisation, which, yeah, I keep repeating. Yes, Nithu says blood spelling is wrong. Yeah, okay, so I didn't correct every tiny mistake in the letter. I didn't have time. So yes, I think he spelled it B-O-O-D, but yeah, small thing. Yeah.
Last question, Fiona, I think, or is that it?
That's it, actually, the ones that I have. Yeah.
Fantastic. Thank you so much, Fiona, for all the help and support you've given our doctors and nurses today. Really appreciate it. This is an area that, with OET writing, it's an area that a lot of students struggle with. So hopefully it's been helpful to you today. Please let me know in the chat box if today's class has been helpful for you. I really appreciate, like I said, that we've got some, a really fantastic teaching team, all UK native OET teachers, just like Fiona. So Jyoti said very helpful. You're very welcome, Jyoti. Hope good luck for your exam, as we say in the UK, fingers crossed. I'm sure lots of people are going to write messages about how helpful it's been. Faz, that's a fantastic session and helpful. You're very, very welcome. If you want to ask questions about the OET challenge that's going to be starting on Saturday, please we're going to have a question and answer session now, but I know Fiona's got a class to teach, so Fiona, feel free to go, and she's going to be teaching our VIP students in about 10 minutes time. But for anyone who wants to ask about our paid program, then I would love to help you, and by answering your questions, telling you a bit more about the program. I'm going to be stopping on Facebook now, so thank you very much for everyone who was on, who's been on Facebook and watching. Actually, I'll probably continue for another 5-10 minutes or so on Facebook, just because I know people have got questions about the program. User said, "You are amazing, Fiona, thank you. If my exam in December, is it not useful?" Fazad, yes, it's for people who've got their exam next week and in December, so November and December, okay? Though that will be the best, the most effective program for those students who've got their exam very, very soon. And yeah, so I'm going to be telling you a little bit more about the program right now. Moto said, "Thank you, ma'am. It's really helpful. So really valuable points." You're very welcome, Moto. Thank you, Alex and Fiona. You're very welcome, Thushara. So yes, I'm going to be telling you a bit more about the OET challenge, telling you about the 50% scholarship. I know that some people like Love Me, etc. have already applied for the program. We will be letting you know probably tomorrow the decision about whether you've been accepted or not for that OET scholarship. So it is a 50% scholarship. A few people have asked about how you can apply for this. I'm going to show you now. So anyone who was just here for the free class, then that's fine. Anyone who wants to know more about the OET challenge, then I'm going to be talking about that now. Like I said, I'm going to quickly share my screen and show you the two packages again. Because we have kept them very, very affordable. If you go through the scholarship, then to get 7 days of corrections and speaking mock exams and courses from us, from one of our teachers, only $49. Okay, if you get approved for the scholarship, that's 90% cheaper than the one OET exam. Okay, if you take 2 OET exams, it's $1,000. 3 exams is $1,500, and so on. So I want you to pass first time. Okay, so you only need to pay for that OET exam once. So many students are doing self-study and they're taking the exam 2, 3, 4, 5 times, and it's a lot of money and a lot of frustration, really, and a lot of time wasted. So we want you to pass first time, and we want you to join our 65% and above students who pass first time. That's what really we want you to have. So that last minute support, 7 days of corrections, can make a huge difference. Someone asked, I think Annie said, can you really help us in just 7 days? Well, I'm telling you, we've done this for 6 months now, and we've had students who got a C+ in their previous exam 1 month ago, took the 7-day challenge and then got a B in writing and a B in their other 3 areas of speaking, reading, listening, and passed on their next attempt. So it's very much possible. We've also had students who had a 6.5 in IELTS, took the OET exam first time after taking our 7-day challenge, and they passed first time. And they don't need to think about English again. They can completely forget about English altogether. So this is what we've got for you. So it's either $99 for the starter package or $49 if you get the scholarship. And then also the premium package, you can see the corrections. You get 20 letter corrections from our teachers, and it's $199 over the course of 7 days, starting this Saturday, finishing next Friday. Or if you get approved for the scholarship, it's only $99. Okay, so we've kept it really, really affordable, no matter whether you're in the Philippines, India, Saudi Arabia, the UK, wherever that might be. So we just want as many passes as possible, and we want to celebrate your success. So these are the packages. If you've got any questions for me, then I'm more than happy to answer them. Okay. Jennifer said, thank you, Fiona. It was so helpful. I wish to join, but I only have a few days left. Is it possible? Well, user one, like I said, if you paid $500 for the OET exam and you do self-study for the next 7 days, okay, and you don't get the score that you need for writing because you don't know what mistakes you're making, you don't know what score or what level your writing's at, then if you fail, then you'll have to take the exam again and pay another $500. So this is a very affordable program for you to get the support that you need in order to pass first time or your next attempt or whatever it might be. The other thing I'll say is that the courses, the video courses that we give you and the OET class recordings, they're available forever, okay, even after this program finishes. So you can still get access to these again. The speaking mock exam recordings you can get access to again. So this program is specifically designed for people who've got their exam in 7 days time or next month, so in a short amount of time. Okay, can you explain more about the speaking practice in this package? Sure, Fazan. So it's a speaking mock exam group class with one of our UK OET teachers. Students will take turns to have a role play. Okay, we'll be giving priority to the premium students to make sure they all have a chance, but we'll give as much practice to as many people as possible. So you'll do a role play with one of our teachers, and they'll play the role of the interlocutor, and you'll play the role of the nurse or the doctor, and you'll go through the 5-minute role play, and then we'll give you feedback, tell you about your pronunciation, tell you about your grammar, tell you what you need to do to provide a better answer, tell you more about your relationship building, your empathy, your reassurance with the patient, tell you what your score was at the end of it and what you need to do to improve. It's really good experience, really good opportunity for you to get practice with a real UK native OET teacher. And we've been doing these speaking mock exam classes for a long time now, so we know what we're talking about. We've had so many students get A's and B's in speaking, so I would love to help you too. And he said, my exam's coming up. Can you tell me how would I consume the package in 7 days? So you've got access to all of these corrections, Annie. So, you know, we've had, like I said, we've been doing this for 6 months. It's not the first time that we've done this challenge. We've had lots of students, like I said, who've passed first time from taking the 65% plus pass rate. So these students have put their letters inside the Facebook group. They've got corrections from our UK OET teachers. We've given them practice for their speaking. They've had chance to go through all of our video courses to learn the theory, and then the practice is they put the letters inside the Facebook group and get corrections. So we are here to support you for the full 7 days. It's intensive, so you must be willing to work hard. We don't guarantee you will definitely get a 4 Bs after this, but what I would say is the students who work hard, okay, and the students who are at the required level, if you do all the things that we ask you to do, you use all of our tools that we're giving you, all of the things here on the screen, and you put them into practice, you have got a very, very good chance of getting your 4 Bs or even above. Some students have got A's before A's and Bs, so it's very much achievable. If you're taking your exam in 7 days, you want to pass on this attempt, so you don't need to pay for a second or third exam, then this is the course for you, is what I would say. But like I said, we're not accepting everybody. We do want you to meet that required criteria, 6 or 6.5 in IELTS, or C or C plus or above in OET, and we will then accept you into the program. But we cannot have too many people in this program. It's just for a limited number of students. We've got other questions coming through. So we will be announcing the times of the classes for the speaking mock exam group classes, and we'll be making sure that all students can attend based on their times and days of availability. So we will be announcing those times and days very, very soon. But we usually make them more available for students who are based in Asia or the Middle East, so making sure it's your evening time. But then again, we've got a lot of students in the UK who take time off work for the exam week, so they have their full exam week off work, and so that they can really devote their time. And I would say that to you as well. If you can get time off work next week, I would highly recommend you to do that, because this is so important. If you pass this exam, you have a better life in the UK, hopefully, from what you're experiencing right now, better salary, more freedom, better life for you and your family. All of these things, a challenge of working in a UK hospital, or even Australia, if Australia is your target. Marga said, do we need to submit our 20 writing answers within 7 days? Yes, it's what really we want to do, Marga. We want you to use as much of the 7 days. We want you to use as much of the 7 days as possible, because if you're at CC plus right now, these 7 days can definitely get you. You can definitely make those improvements. I've seen students who had a C or a C plus before, took 7-day course, did their writing corrections, so they're writing in the letters in the group, and then they got B's. So, I don't want you to just do, 2 letters over 7 days. I want you to do as many as possible after reviewing our feedback, because this is where you will start to see those improvements in your scores. So, yeah, very good question. Okay, so yeah, the video courses and the recordings are available every day for you to go through in your own time, to do the exercises as well. The Facebook group, we will mark your letters within 12 hours usually, okay, within 12 to 24 hours, but usually within 12 hours of you submitting your letter. So we want to give you as much support for your writing as possible, but we'll also answer questions you have on reading, speaking and listening too, as well as the live group speaking mock exam classes. What else? What other questions have we got? How can I register through the agent? Said Rafida Mohammed. Okay, I'm going to show you how you can do that. So you can see here, to get the scholarship, if you're a doctor, you complete this form. It's a very it's quite a quick form to complete, 5 to 10 minutes maximum. So this is one for doctors, this is the one for nurses. I will show you what that looks like on my screen. So if you go through to, let me see, if you go through to our challenge page, so I put the website inside the chat box, but I'll do that again. It's swooshenglish.com/OET-challenge. Okay, so you just put that in there. I'll just put it in the chat box for you. swooshenglish.com /OET-challenge. Okay, so I've just put that in there. And what you do, if you want to get access, if you just want to buy the course directly, then you can literally click Get Started, and you can choose whether you want the starter package or the premium package, okay? But if you want access to the scholarship, you can see here, the 50% scholarship, I'm a doctor or I'm a nurse, okay? So if you're a doctor, for example, you click this link and it'll take you through to the form, and all you need to do is complete this very quick form, okay, a few questions, and then once you've completed that, then we will give you access. We'll let you know tomorrow whether you've been approved or not for the scholarship. So the starter package would only be $49, very cheap, and it's 1/10 of the price of an OET exam. So we want to help you as much as we possibly can with this. Okay, so hopefully that answered your question. But yeah, very easy to sign up. If you want to, for example, if you want to choose the premium package, just click this sign up button, okay, and then it will take you through to the enrollment page here, and you just go through and decide whether you want to choose your credit card or you want to check out with PayPal. So very, very easy there. So I am going to, for any students who are on Facebook Live, okay, I'm going to put the link on Facebook for you, but I will be stopping this class on Facebook now because I know that some students want to ask me questions directly. So I'll be speaking to some students in a second. Okay. So I probably will continue actually on Facebook. Just because I know that some students who are asking me questions, they still want to be watching this and to learn from the answers, so I'll keep this running. But what I've still got a lot of students on Facebook, on Zoom right now who want to ask me questions. So if you want to speak to me face to face, then I'll bring you into the session today. Just speak one student at a time, okay? And I'll bring you in now so I can see who we've got here. So just be aware that I am still on Facebook Live. If you don't want to show your camera, then that's fine. You can turn it off. And I will bring you in now to this session. But it's just one student at a time. George, I can see you. How are you, George? Huawa, I can see you. Good to see you. Hopefully you enjoyed the class today. Who else have we got in? We've got, let's see. We've got Gina. Who else have we got? Babu. Just bring everyone in here. Joyce. Who else have we got? Anyone who wants to ask me a question, just unmute your microphone and I would love to help you with any questions that you do have. Okay, so Joyce, nice to see you. I can see you. Okay, I think I am guessing you might be in the Philippines. I'm guessing we have a lot of Filipino nurses. We're just judging by your last name. Who else have we got? Khalid, I think, has just joined our VIP program. Good to see you, Khalid. If you've got any questions for me, I'm more than happy to answer any. Ma, good to see you, Ma. I can see you. Anyone? Ma, have you got any questions for me? Or G-Tel, I can see you. Any questions for me? Anything about the OET challenge? Mainly, I'll be answering questions about the OET challenge. So if you've got any questions about it or about the scholarship, then I am more than happy to answer questions. But if you've got questions about the OET writing in general, the letters, etc., then just put them inside our Facebook group community, which is a free community we've got on Facebook. You can put them in there. I think someone's got their microphone on. Does anyone want to ask me any questions? Please let me know. Anybody? Khalid, did you just join our VIP program?
Yes.
Hi, I recognize your name because we were sending some emails to each other. So great to see you in our VIP package. When's your exam, Khalid?
December.
December. Okay, good. Okay. So basically you're in our program now. Have you started going through our video courses?
No, I'm just trying to make a fast review for the courses.
Okay. Good. So but have you actually started looking at them today?
Yeah, only a few days, and I have joined this 7 days intensive course. I hope I will gain some benefit.
Fantastic. So we will, just to let you know, Khalid, we need you to work, and I'm sure you're a doctor, correct?
Yes.
Yeah. So, all the doctors and nurses who join our programs are really hard-working, committed people. So I just want to let you know, it's not an easy challenge. We ask a lot of you. We ask you to put everything into this because these challenges for students who are taking the exam in November and December, we want you to have huge improvements because for us, there's no better satisfaction than when you send me a message after your results and you say, hey, Alex, just want to let you know, I'm really excited to let you know I passed my exam first time and I don't need to take OET anymore and I can move on with my with my medicine career or my nursing career in the UK. That's really what we want. And the other thing as well, as a school, okay, it's within our best interest to help you to pass. Because if you're taking the exam 2, 3, 4, 5 times, then we're looking at ourselves as teachers thinking, what are we doing wrong? Why can this student not pass? So we need you to pass first time. We need to publish your results on our social media and to our other VIP students to inspire them and to let them know how Swoosh English have helped them. So it's within our best interest, Khalid, to help you as much as possible to pass your exam. So great.
I'm looking forward to that. Thank you.
Sorry, say again?
Yeah, I'm looking forward to that moment. Thank you.
Fantastic. Oh, you're welcome. Where are you living right now, Khalid?
What,
Oh,
please?
I don't know who that is, but if you can just mute your microphone for a second. Yeah, Khalid, where you living?
I'm working in Saudi Arabia, but I'm
Okay.
originally from Jordan.
You're really from Jordan, okay. Well, we've helped Jordanian doctors before to pass OET and IELTS, so I look forward to helping you. If you've got any questions for me, I'm always available to you, Khalid. Just are you inside of our Facebook group yet? For our package students, if you go to the email confirmation after you signed up for the package, you can see that there's a Facebook group link, and what you need to do is you need to join that Facebook group. Very important that you join that group, and I'll accept you into the group once you make that invitation.
Yeah, I will check now.
Okay, fantastic. Great to see you in the program, Khalid. And what did you think of the class today?
Sorry?
What did you think of the class today, Khalid?
No, it was great. Yeah, it was my first experience with you face-to-face, but it was great, and I have learned many points. I hope we will improve more and more.
Fantastic. I'm sure you will. So yeah, great to see you in the program, Khalid. Okay, who have we got next? Jayoti, I can see your smiling face. Do you want to ask me a question?
It was great today, and I learned many points. Thank you for that.
You're very welcome.
Yeah, my exam is on November 3rd, so I'm looking forward for that. Probably I would like to register for your course, and I'm looking for the scholarship, like if I can apply for that, and that will be helpful.
Sure. So do you know how to sign up for that scholarship, Jayoti?
Just now you told, so I just Googled and I got it. So
fantastic.
Let me do that. Yeah.
Okay, fantastic. Yeah, I mean, any questions about what scores have you taken the OET exam before? Or have you taken out?
No, this is for first time. Yeah.
Okay. Have you had any teacher previously give you help with your writing or your speaking or anything, or any kind of feedback or corrections?
Yeah, I just joined. I just contacted one native OET teacher, but she's helping more to nurses rather than doctors. But she has a doctor student as well, so she's helping me a bit. But I've just started.
Okay. Well, if you're just starting on the journey now, then and actually I don't really know what your English level is is at the moment. But what we do have another thing that we want to we're going to be providing to the premium package members is we've got a full mock exam for reading and listening 2.0. Sure. So we've got that we're going to be adding to the premium package for students who join that. So yeah, if you join the starter package, it's $49 with the scholarship. But if you join the premium package, it's $99 with the scholarship. So those are there for you to choose which one you want to have after you've been approved for the challenge. But we'll let people know tomorrow if you can, if you want to join if you've applied for the scholarship, we'll let you know tomorrow whether you've been successful or not.
Yep.
Fantastic, Jayoti. Where you living, Jayoti?
India.
You're in India. Which part?
South India.
Which part?
Chennai. It's in South India.
I know India very well. I was in Kerala about 3 months ago.
Sure. Okay.
Yes. Kerala was amazing. I really enjoyed it.
Okay. Do you know Chennai?
I've not been to Chennai, but I've been to like Bangalore, Mumbai, Goa.
I'm nearby.
You're nearby. When I was in India, I even picked up the head shake as well in Kerala. I started doing the head shake as well. So that was I really got into the Indian culture when I was out there. So, okay, but Jayoti, we would love to help you. Did you benefit from the class today?
Yeah, sure. It was great, and I learned the format and the style you said. But I have been practicing to myself as well. So, but looking forward for your course, and it will be great if it can help me in passing the exam.
Yeah, well, I look forward to helping you, Jayoti. Like I said before, we just need to, Khalid, we need, people who are, really committed, really willing to do everything that's possible over these next 7 days, starting on Saturday and finishing next Friday. So and the other thing as well, we'll put you all with study partners. So we'll give you a study partner. So Khalid, you'll get a doctor who we match with you. Jayoti, you will have a nurse you're a nurse, correct?
No, I'm a doctor.
Oh, you're a doctor. Oh, actually, I was told Chennai is very famous for doctors.
Yeah.
That's a place where
I'm a radiologist.
A radiologist. Okay, so Jyoti, for example, we could put you with Khalid, for example. You could both be study partners, or whoever that might be. But yeah, it's really important to have that study partner as well. You can support and motivate each other, and you can practice your speaking together as well. Because of course we'll do the speaking mock exam classes, but it's good as well to keep doing that practice every single day to to really get the practice and the confidence really that you need for the speaking exam. So yeah, great to see you, Jyoti, and hopefully we'll review your application for the scholarship and we'll let you know tomorrow.
Sure. Thank you.
Thank you, Jyoti. Any questions? User one, I see you smiling away. If you want to ask me any questions. Annie, you've been very interactive today. Annie, have you got any questions for me?
Yes, I'm trying to join with your scholarship, but I don't know how to. So would you be able to help me to do that?
Sure. What problems are you having with completing the scholarship form?
I think I got it from my email.
So let me show you. Let me show you how you can apply for the scholarship. Okay, so you can see here. So you can go to swooshenglish.com/OET-challenge. Okay, and you can see. So I've scrolled down to. You can even click Get Started, and scroll down here. And you can, if you see just below the package table, you can say about with our agency partner, you get a scholarship. Are you a nurse or a doctor, Annie?
I'm a nurse.
A nurse. So I'm a nurse, okay, and I want the scholarship. You can click here, and then you come through to this form, and you just have to answer the questions.
Okay.
Okay. So
okay.
If you need any more help, just let me know. But you should be hopefully straightforward enough for you.
No problem. Thank you.
Fantastic, Annie. So yeah, look, did you enjoy the class today? Did you learn a lot?
Yes, I like Fiona's and how she explained how to get a big grade on writing, because my writing is my weakness, so I definitely need help. Yes.
Have you taken your exam before, Annie?
Yes, this will be my 4 times, and I'm really disappointed because I just get C- grade. So, and I have been studying really hard and got some really help from other teacher, but it doesn't seem that I'm passing.
Sorry to hear that. Sorry to hear that. When is your exam? Is it next week?
On the 3rd of November.
3rd of November. So it's next week. So Annie, I'm happy that you're honest about how many times you've taken the exam and
yes.
Yeah, and it's good. It's good that because I've spoke to some students before who've taken it 6 or 7 times when I found out in the end, but really they told me that they'd only taken it twice, and because they were too embarrassed to say that they'd taken it quite a lot of times. But one thing I would say is, Annie, don't worry about those previous exam attempts. Okay, forget about all of those, because that wasn't, when some students they say I failed. You didn't fail, you just didn't pass, okay? Because that word fail is not good. What I would say is you didn't pass, maybe you didn't get, it's not necessarily all of, don't think it's your fault or your mistake or whatever. It's maybe you didn't have the support that you needed is probably what I would say. You were doing the best that you could with the tools that you had available to you.
Yeah.
Would you be fair would that be fair to say?
Yeah, you guys quite very professional, so I like to hear, and I'm looking forward to work with you guys.
Good. Annie, have you taken any courses or ever had a teacher before helping you with those 3 previous attempts?
Yes, I have actually.
Oh, okay. You don't need to don't mention the name to me.
I'm not going to mention.
Yeah. Okay. But so you've had a teacher before, and did that help you or not?
It's actually, they were helpful and I have improved, but I think I need more, need more help.
Right. Was it native teachers or not native?
Well, it's native, some Australian, some from UK.
Right. Okay.
Yeah.
Okay. Well, I mean, it was good that you got good that you got support from teachers, because a lot of students who don't pass, it's because they've just done self-study. So I think it's good that you've looked for some support from
Yes.
native teachers. But I'd be, actually, tell me, what scores did you get previously?
With my writing, I have C minus.
There's no C minus. It's just C or C plus.
Or C, yes.
C, you got C. Okay. Was that every time writing for the 3 exams? So you've done it 3 times and you're doing your 4th one next week?
Yes.
Right. And so you got C for all of those for writing. Have you ever got a C plus?
On my online study, yes, I get C plus, but
on your exam, the main thing is the exam.
Yes, yeah.
Did you get a C plus in your previous exam?
No, just C.
C. Okay. So for with your exam next week, because you do realize that's to go from a C to a B is 2 levels higher.
Mm-hmm.
You know that, yeah?
That's okay. So, yes, yeah, I realize that.
It is achievable. It's definitely achievable. I've seen students before have a C and they've taken our OET challenge and then they've got a B. So it is achievable, just to let you know. But you're going to have to work very hard for the next 7 days.
Yes,
are you willing to do that?
Yes, I'm willing to do that, and I believe that you have to work really hard too.
Absolutely. Sorry, go on.
Yeah, and I found you guys really helpful and have that courage to get their student to pass. So I would like to try you guys, and maybe different techniques maybe would help me.
Yeah, absolutely. It's as they say, you should always try. If you've tried something and it didn't work for you, then try something different in order to prepare. Yeah. So Annie, we look forward to working with you. Make sure if you want to do that scholarship, complete that, and we'll let you know tomorrow.
Absolutely.
Okay.
Thank you very much. I'm looking forward to work with you guys. Yes.
Very welcome. Where are you living, Annie?
Australia.
Oh, Australia. Oh, so it's very late now in Australia.
Actually, it's 11:20.
Okay. Okay, not too bad. Not too bad.
Not too bad, yes.
Okay. Well, Annie, fingers crossed for you.
Thank you. Thank you so much.
You're very welcome, Annie. Okay. So anyone else got any questions? Anything you're not sure about the OET challenge that I can help you with? Babu? Hello, Babu.
Oh, hello. Yes, Alex, how are you?
I'm good. How are you, Babu?
I'm perfect. Thank you. Thanks a lot for your wonderful class today.
You're very welcome.
Basically, I'm from Kerala. I'm glad I heard you've been in Kerala.
Yeah.
Alex, I just want to ask, I really want to join that challenging, but I don't know what's your timings, because I'm in South Africa and I'm working actually daytime. So I don't know.
You working in Jeddah?
No, I'm working in South Africa right now.
South India?
South Africa, in Cape Town.
Oh, South Africa. Sorry. Oh, yeah. South Africa. Okay. Well, so just to let you know, Babu, we've got doctors and nurses from everywhere in the world. Like you just saw Annie is living in Australia. You've got Khalid who's living in Saudi Arabia. You've got doctors and nurses in the UK. You've got India, Philippines. I mean, we've had students from all kinds of countries. So the writing corrections, you can put your writing inside the Facebook group at any time of day. Okay, it doesn't matter which time of day. You can put that in any time of day. Okay, and we will mark it for you. Like I said, within 12 to 24 hours. Usually within 12 hours, because we have a teacher in there who's constantly giving support and feedback and corrections, etc. The speaking mock exam classes, what I usually do is I usually say 3, but I end up doing 5 or 6. So for these challenges, I always seem to end up doing more. It's usually me and one of my other teachers who does these speaking mock exam classes. So we will do as many as we think students need to be best prepared for the speaking role play. So, you know, we'll do them at different times of day to meet different people. So you've got Annie who's in Australia, you've got Khalid who's in Saudi Arabia, you've got you that's in South Africa. You're all over the place kind of time zone wise. So we'll try and help and support people and be as flexible as possible with those times. Okay,
thank you.
You're welcome, Bobby. Did you so what did you learn from the class today?
Yes, it was perfect. You know, actually, this is I took a data on December. This is my second time.
What scores did you get the first time?
Writing C+ and reading. Sorry, writing and reading C.
Writing and reading C. Okay. So as I mentioned, for the premium package, we've got we've got materials for you, you know, in terms of our reading video courses, because you got a C last time, so we need to get you to a B. But also we've got our, you know, mock exam. It's a brand new mock exam that Swoosh English have put together. So these are not something you've seen on the official OET website, where, you know, that's a really important element to have that mock exam practice, but all the materials as well. It's obviously really important. And the writing, you said writing you got a C as well?
Yes, correct.
Okay, and when's your exam? Is it next week?
No, December.
Oh, sorry, you said December. Yeah, okay. So it's good that we've got some extra time with you in order to help you to get that score, but really make the most use of that writing, you know, the letter corrections that you can get over the next 7 days, and you know, that will really help you a lot. So yeah, you make full use of that.
Thank you.
You're very welcome, Babu. So glad to hear you had some benefit from the class today, and yeah, and let me know, is it the scholarship you're interested in, or just the package in general? Are you looking to move to the UK?
Yeah, in just a practice in general.
Okay.
Because I already got a package, everything. So yeah.
Okay. Are you a doctor or a nurse?
No, I'm a nurse.
You're a nurse. Okay. Good. All right, Babu. Cheers. Thank you very much.
Thank you. Thank you.
Okay. Anyone else got any last questions? Anything at all? Joyce, Miradzo, Pina, Hazim, anyone, even anyone on Facebook? I think we've still got people asking on Facebook here. But yeah, let me know. Oh, I don't know who that was, but if you've got any questions at all, then more than happy to answer them for you. Okay. Mariela Bautista on Facebook said, how can I join the OET challenge? I'm going to put the link for you, Marielle, inside the chat box. It's swooshenglish.com/OET challenge. Also go to our website. You can see we've got a page, if you find it on Facebook, showing different passes that we've had before on it's called Swoosh Love, which is one of our website pages, and it just tells you about some of the experiences of some students who've passed with us before. We've got videos on YouTube of students who've talked about how the courses that Swoosh English provided them helped them to pass. So go to our YouTube channel and you can look at them there. But aside from that, everybody, thank you very much for coming along today. We've still got Doshara, Pina, Babu, Annie, Jyoti, Khalid, Joyce, and Angela is new to our Swoosh team. Good to see you, Angela. Hazim as well. And thank you very much. I think that's probably everything. So I'm glad that so many people enjoyed the class today. And if you have got your exam next week, or you've got your exam in November, I'd love to see you in the OET challenge. But if not, of course, that's fine as well. But just let me know how you're doing, because our mission, as you can see on our homepage of our website, is to help as many doctors and nurses to pass this exam as possible, so that you can go to the UK or Australia and, you know, have a better life. And I think that's the main thing that, you know, that we take great satisfaction from, is helping you and your family. I went last week to before I go, there was a doctor, an Italian doctor that that Swoosh English helped, and I helped to pass her examination. And then she sent me a message on Facebook saying, hey Alex, I passed my exam, thank you so much. I'm currently working in a pub right now, and so serving beers and drinks and things before I start my job as a doctor. I passed my OET exam. Please come to the pub because I want to buy you a free beer. Buy you a free, but I want to give you a free beer. So I went along. You can check on Facebook if you want to see that. But I had a very nice afternoon with her. up with her for a couple of hours, and she told me about her experiences with OET, and I got a free drink. I didn't need to pay for it, so that was her my reward for helping her to pass. So if you pass your exam and you want to buy me a beer, and you want to give me a free drink, then I'm more than happy to accept that from you in exchange for you starting your career as a doctor or nurse in the UK or Australia. So thank you very much, everyone. I look forward to seeing you in our program, but if not, I hope that you will pass your examination. Thank you very much.